Hello, welcome back to my YouTube channel. Today in this video, we are going to learn the typical thoracic vertebrae. There are 12 thoracic vertebrae and second to eighth thoracic vertebrae shares common features and they are known as the typical thoracic vertebrae. The remaining first, ninth, 10th, 11th and 12th thoracic vertebrae presents atypical features. Hence they are atypical thoracic vertebrae. Come, let's see the features of a typical thoracic vertebrae. A typical vertebra has got a body. So this is the body, and posteriorly there is an arch. This arch is known as the vertebral arch or neural arch, separated by means of a foramen. That's a vertebral foramen which launches the spinal cord. So here we have the body, and posteriorly it has got a vertebral arch. In a natural position, the body of the vertebrae is directed forwards and the vertebral arch directed posteriorly. The body and the vertebral arch are connected by means of a broad piece of bone which is known as the pedicle. A pedicle has got two surfaces. There is a medial surface and lateral surface. Anterior border which is fused with the body, posterior border is fused with the laminae, and it has got a superior border and inferior border. At the superior border we have superior vertebral notch, and inferior border we have inferior vertebral notch. The lateral surface of the body of typical thoracic vertebra has got two facets, one is superior and one is inferior for the head of the rib. They are known as the causal facets. The superior demifacet and inferior demifacet. When two vertebrae get articulated, the superior demifacet of the lower vertebra and the inferior demifacet of the higher vertebra forms a complete facet for the head of the rib. It articulates with the rib to form the costovertebral joint. At the superior border of the pedicle, there is superior vertebral notch, and at the lower border of the pedicle, there is inferior vertebral notch. So the superior vertebral notch and the inferior vertebral notch joins to form the intervertebral foramen through which the spinal nerves emerges. Now, the vertebral arch has got two process here, which is directed laterally, posterolaterally, which is known as the transverse processes, and one which is directed posto-inferiorly. This posto-inferior part is the spinous process, and in addition, it has got two process which is directed upwards. That is a superior articular process. The same time, inferiorly we have inferior articular process. So here we have the pedicle. Okay, from the pedicle we have two transverse process and we have two spine, and there is a spinous process. And if you trace this spinous process forwards, we can see two broad part which is known as the laminae. These two are the laminae, or in other words we can say that these laminae fuses to form the spinous process. The body has got a superior surface, and here we have inferior surface, then there is an anterior surface, there is a posterior surface and two lateral surfaces. The superior surface of the body articulates with the inferior surface of the higher vertebra through intervertebral disc. Now let's see the features of a typical thoracic vertebrae. You can see, so I'm having a typical thoracic vertebra and the body is heart shaped. And I already told you, so here we have a superior articular process with superior articular facets. You can see there is a rounded facet, and at the lower part, so we have inferior articular process with inferior articular facet. Okay, so here I'm having one more vertebra, the same vertebra here. So the superior articular process or the facet articulates with the inferior articular facet of the higher vertebra. You can see here. See, this is a superior articular facet of the vertebra which articulates with the inferior articular process of the higher vertebra. Okay, and the joint is known as a zygapophyseal joint, and it is a plain variety of synovial joint. Remember this point.